UK's lifestyle menu, the community, coaching, and education to help you reverse chronic diseases such as obesity, heart disease, high blood pressure, high cholesterol, and even some lifestyle cancers such as breast, prostate, and bowel cancer. If you're new to us, I'm Dr. Linda, emergency medicine physician here from Sheffield, and I am here with my amazing co-host, Dr. Erica, who is a GP from the West Midlands. And we are both lifestyle medicine physicians. You can find us every single Sunday at 5 p.m. UK time on Zoom, as well as you can watch this live recording on YouTube and on Facebook. And if you haven't said hi to us yet, do check out our social media with the handle Afternoon Tea with Docs, both on YouTube, Facebook, and also actually on Instagram and LinkedIn to say hello and let us know what are your lifestyle goals.
So today we're delighted to have Dr. Viral Sheth with us, who is an integrative cardiologist and medical writer with a focus on disease prevention and health promotion. He also has a background in public health as well. So welcome, Viral.
Thank you. Great to be here.
Thank you for joining us. We always love to ask our speakers a little bit about themselves before we get into the interview, sort of what inspired you to do medicine in the first place and what led to you doing more kind of preventative cardiology.
Yeah, so again, thank you for the invitation. So why did I go into medicine? That was a long time ago. Usually, the parents always have something to do with it. But I kind of stumbled into my passion. I remember when I was I went to college for 2 years. I was one of those people that really wanted to be a doctor and get it over with. So I went to college for 2 years. I went to medical school for 4 years, and then I did my residency and cardiology fellowship. And the reason I got interested into cardiology was when I was doing my internal medicine residency, I was seeing a lot of people showing up with horrible heart attacks, and they were dying. And there was very little we could do in the early days other than give clot-busting medicines. And it was really, I was like, oh my goodness, this is a terrible thing. What can I do to help? How can I make a difference? So I decided to go into cardiology. And I've been practicing conventional cardiology, meaning cardiology that's basically what normal regular doctors do, which is basically, prescribing medications and recommending procedures. I did that for about 20 years, and I was getting kind of frustrated. I was feeling like I was more of a drug dealer than anything else. So then my focus turned to prevention. I've always had a passion for prevention, but I got into integrative medicine, which is a more of a holistic lifestyle approach in addition to the conventional approach. So that was my and I really have found my passion, and I'm doing what I love to do right now. And I try to live a lifestyle that is consistent with what I recommend to my patients. So I'm a big believer in things like intermittent fasting. I find that it helped me lose about 20 pounds, and I have a tremendous energy, and I don't think I've gotten sick in past few years. I'm a big believer in exercise. I love hiking. I've been hiking all over the world. I'm a big tennis player, and I enjoy going to the gym and working out. I try to do something every day. I try to mix it up so I don't put too much attention on any one specific muscle group or tendons or joints. And other than that, I'm a firm believer in mindfulness. I meditate. I do yoga on a regular basis. I do a lot of So that's me.
That's great. And I just wanted to pick up on something that you mentioned about conventional medicine and kind of you changing your focus. And when you talked about conventional medicine, you talked about prescribing pills. And yeah, I think actually, from medical school, we have learned about just a little bit about things like lifestyle medicine, but in very little detail. Actually, lifestyle medicine is the foundation of conventional medicine. And we often link risk factors such as smoking, sedentary lifestyle, and poor diet and things like that with diseases. And when we talk about treatment, so in the UK, all doctors are familiar with something called the Oxford Handbook, and we all have one. And often with majority of the chronic diseases, the first line treatment is lifestyle changes before we go into prescribing medicine, and then lastly surgical options. Yet that important bit of the first line treatment of lifestyle changes is not very well taught, and we know very little about it. So we can't really give proper advice and a dose specific prescription on lifestyle for our patients.
Yeah, you make some great points there. So here in the U.S., specialists tend to see a lot of the patients, because that's just the way medicine is here. The primary care doctors will refer to specialists, and unfortunately, there isn't enough time for many primary care doctors to educate their patients like they want to when it comes to lifestyle change and nutrition and exercise. And with the specialists, especially in terms of cardiologists who are conventionally trained, they have very little training in nutrition and what's best for the whole mind-body connection. And they get frustrated with their patients, and they just start giving them drugs and looking for the effect in their blood work. And it's an easier, really lazy way to get patients to goal. And I say lazy because there's no reason why 80% of cardiovascular events can't be prevented with lifestyle alone. I mean, you just need to put in the effort. There are health coaches that you can employ to help your patients. So it's a problem with the system here in the U.S. The training here in the U.S. and the reimbursements here in the U.S. Nobody's going to reimburse providers for spending an hour with a patient and trying to educate them on how to improve their lifestyle so they can take fewer drugs. It's much easier to prescribe the drug and see the patient back. But it's a problem that's just not with the provider, but it's the whole system.
Yeah. And you mentioned about the cardiologists getting frustrated with their patients, and perhaps with medications as well. Medicine compliance is not always great, and any one of us who have ever taken medicines for anything, sometimes we do forget, and for those people who perhaps don't even know why they are taking certain medications because of the limited time that we have in our clinical, in our clinics, perhaps that isn't always explained very well to patients, especially for people who don't have symptoms, but with risk factors such as high blood pressure, high cholesterol. They don't feel unwell in themselves. So to get them to understand that perhaps they need to make some lifestyle changes or to take medications for certain things, that might be a bit difficult to kind of ensure that they do what has been advised.
So, I mean, you make some great points. So what I've learned is that I can get my patients to change their behavior better if I can show them exactly what's wrong. And so for a lot of my primary prevention patients, people who come to see me who have, let's say, a family history of heart problems or who have a little bit of hypertension, who are, let's say, 40 years or older, what I'll do is I will send them for a test called a calcium score. I'm sure you do that in England. It's a low radiation, non-contrast CT scan, and it actually measures how much calcium a person has in their coronary arteries. Basically, what that's telling you is what that person's lifetime exposure to endothelial dysfunction with all the toxins in their environment and their lifestyle has done for them, including their genetics. And if they see a calcium score that's above 400, they're at a very high risk of having an event in the next 5 to 10 years, even though they're feeling wonderful. And it's amazing how that little piece of information can motivate our patients, at least my patients, to be more compliant with medications and start to really make a conscious effort in changing their lifestyle, moving more, eating healthier, getting better sleep, etc.
I guess the key there is actually knowing that they can do something about it to prevent things from getting worse or even making things better. And I think often we maybe don't give that hope to our patients that there is a possibility that things can look better in the future and you don't have to just get worse and worse.
Absolutely. So you're talking about giving our patients agency over their own health. And I'm a firm believer in everything that I recommend is shared decision making. So it's as much as their decision as it is mine. And what I try to do is I try to tell people, I try to ask people to change their behavior, not for themselves, but for what's important in their life, what gives them meaning in their life. And a lot of the times, if they're elderly, it's their grandchildren, or it's their children, or it's, being around for a certain event or a wedding, et cetera. So it's really important to try to, at least for me, get my patients to find meaning in their life so that they can actually improve their lifestyle so they can live longer for a purpose, not just because I'm telling them to.
Mm-hmm. And do you find that conversation easy to have in clinic, kind of digging a little bit to find out what motivates them and what's important to them?
Well, I've been doing this long enough. So the science piece, it just comes kind of pretty quick for me. So I really delve into the social aspects of my patients. I want to know, where they live, who they live with, how many children they have, what their children are doing, what they do for a living. Do they like their job? And if they're retiring, I ask them, I always want to make sure you do something that keeps giving you purpose in life. You don't want to just get out on a golf course and, it's a conversation. It's information that I look for, and because I guess I get to know them better, and I get to have more of a what I call a therapeutic encounter with my patients, and not just a transaction of prescriptions. So.
Absolutely, and that is so important. And I think when patients feel that the doctors are actually taking an interest in them as a person, rather than just a list of conditions, that the kind of the therapeutic relationship there is much better, and they're also a lot more likely to kind of come on board with the advice, and more open to having conversations about possible changes that they might need to make.
So just to piggyback on what you just said, so my first 20 years of my practice as a conventional cardiologist, I was seeing insane numbers of patients in crazy amounts of literally 5-minute encounters where there is no way other than prescribing medications I could have an impact. So I was burning out. I had clear burnout. I was having the symptoms of burnout. So I had to make a decision. I said, listen, do I still want to do this? And if I do, I need to do it better. So what I did was I actually changed my schedule. Now every person gets at least 30 minutes. New patients get 45 minutes with me. And I find, going to work so much more enjoyable. I really look forward to seeing my patients. They look forward to seeing me. And it's much more of a pleasant, doctor-patient relationship for everyone. So that's I had to make a conscious decision to do that. Not all doctors can, for whatever reason. Everyone has their own reason. Yes.
It's amazing to be able to speak to a cardiologist about all of those cases that I see.
Sorry, go ahead.
In emergency medicine, we see daily heart attacks every single day. There's unfortunately the cases are rising, and it's really palpable, especially after the pandemic, when we have seen the effects of lockdown, increased alcohol intake, increased processed food intake in large quantities, and within 2 years.
Loneliness as well.
Loneliness, particularly in the elderly and in the young as well. So my question would be, is heart disease and heart attacks, is it really preventable? Oh,
sorry.
Yeah.
Oh,
that's good. Can you hear me now? Okay, good. So you mentioned the pandemic. I have a lot to say about that. I think everything you said is absolutely true. The isolation is a risk factor for cardiovascular disease. Absolutely. The anxiety, the depression, the substance abuse. There's been a big spike in overdoses in this country with narcotics and opiates. It's been crazy. It's been terrible. So it's not, and not only that, but patients were afraid to go to the hospital because they were afraid to get COVID. So they were having heart attacks at home. So they were having their heart attacks and their strokes at home. They were coming in too late. So the pandemic has had a horrible effect on both, on both people who have acute illness and chronic disease. And speaking of the coronavirus itself, it has an impact on cardiovascular health itself. When someone gets COVID, there's people say, I just want to get COVID and get it over with, right? No, you don't want to get COVID. You want to get vaccinated. You want to do whatever needs to be done in your community to keep yourself and other people safe. Because when you get COVID, that virus can actually get into your linings of your arteries. It's been shown to do that. And not only that, the cytokine storm that happens after you get infected also damages the artery. So there's clearly increased, risk of MI and stroke in people who've had COVID. Not only that, there's a condition called long COVID. I'm sure you've heard of that. That's where people develop, autonomic dysfunction. And I've seen horrible things like POTS syndrome, where people get tachycardic and lightheaded and incredible fatigue. It all has to do with the fact that the autonomic nervous system has been damaged by the inflammation. And I'm seeing this in young people in their 20s. It's not just, for people who are older. So I think COVID has had an impact, a psychosocial impact, as well as a medical impact, which I think is going to be generations before we recover fully.
And Linda was seeing almost daily in A&E young people in their 20s, 30s coming in with malignant hypertension, with a systolic blood pressure of over 200 and diastolic of over 110 regularly.
And some of that I'm sure has to do with lifestyle as well. Like you said, they were sitting at home, sedentary, and in this country, diabetes has gotten to be real, maybe not a pandemic, but an epidemic. So that obesity and diabetes, because of that sedentary lifestyle, is a real problem for young people in this country.
So very rarely do we actually say the words that heart disease and this heart attack could have been prevented. Is it true that with lifestyle medicine, most of our heart attacks could be prevented?
Absolutely. And we were having a conversation earlier. When I see a patient in my office, my goal is to never see them in the emergency room. And I am successful most of the time because of leading a healthy lifestyle. You reduce inflammation in the artery walls, and you reduce oxidative stress, and you improve nitric oxide. By doing all of those things, you can prevent plaques from rupturing. The goal is to make those plaques hard and not soft. If they stay hard, they don't rupture. And by doing that, you prevent heart attacks. So clearly, you can prevent a heart attack by changing your lifestyle and by taking medications if needed.
And so what are these preventative measures that you advise your patients?
So in terms of...
Before we go into that though, because you mentioned a term earlier, primary prevention, and for people who may not be aware, do you mind just kind of explaining what the difference between primary, secondary and tertiary prevention is?
Sure.
And whether you do all of that?
Yeah, absolutely. So primary prevention is trying to prevent the initial event, meaning somebody may come to you, may come see me because they have, say, hypertension, or they have diabetes, or they have a family history of heart disease, and they want me to help them prevent that first event, whether it's a heart attack or a stroke. That's what primary prevention is. Secondary prevention is when someone comes to see me after they've had their event, meaning after they've had their heart attack or their stent or their bypass surgery. So, and those folks have kind of missed the boat when it comes to primary prevention, but that doesn't mean we can't prevent another event. And that's what secondary prevention is all about. Tertiary prevention, I'm not really sure what that is.
That's okay. I don't have to go into that.
Okay.
So yeah, primary and secondary prevention are the main ones that we're talking about here. And those two group of patients that you see regularly as well.
Absolutely.
And, you mentioned earlier that about 80% of these heart attacks and strokes are actually preventable with appropriate lifestyle changes. And yeah, it's so sad that here in the UK, heart disease remains the second commonest cause of death. And I believe in the US, it remains the leading #1 cause of death. I think in the UK itself, there is one death every 3 minutes from heart disease and strokes. And we know that, 80% of it is preventable. What would you advise your patients who have come to you with for, say, primary prevention purposes? Because actually I believe for some people, unfortunately, their first symptoms is also their last. And about a third of people dying from sudden cardiac death, that is their first ever symptom, and also their last.
And I mean, the points you make are remarkable, and they're very important. We talk about preventing heart attacks, but really we're also talking about preventing sudden death. And you hear it all the time about my friend at work, and he just dropped dead. That was it. And a lot of times patients will come to see me after they've had a friend or a relative that's happened to. So it really is one of those catastrophic tragedies that happen unexpectedly in relatively young healthy people sometimes. So that I hate to say the fear of God is a great motivator, but clearly it can be for some people. And I had talked about before about getting as a motivator for change in lifestyle. I talk about getting calcium scores done for that reason, because if I can show them that even though they haven't had their first event, your calcium, you have all this calcium in your arteries, you are a ticking time bomb. I don't use those words, but clearly they're at higher risk. And sometimes putting that fear of God in somebody will help them change their behavior. Definitely think when it comes to things like smoking cessation and moving more, eating healthier. And that's where the whole the social aspect comes into, because I want to know what's their purpose for living. And if you can emphasize that you want to live for this reason, that reason, then you need to change this behavior and that behavior. It's really about changing behavior, asking people to change behaviors that they've been doing for a long time. And by doing that, you can prevent sudden death. You can prevent heart attacks and strokes by 80%. It's been proven. But the problem is, us as clinicians, at least here in the U.S., many of us don't have the time to put into getting that type of behavior change, and a lot of times, patients can't afford things like health coaches. I mean, the insurance companies aren't paying for those things. But it's interesting when it comes to secondary prevention here in the US, Medicare for people who are over 65 does pay for cardiac rehabilitation. Now, cardiac rehab is something that we recommend people who've had events like the heart attack or stroke or stent or whatever. And they do tremendous work, amazing work, because it's a supervised, reimbursable, usually 10, 15 weeks of, exercise, nutritional counseling, counseling on smoking cessation, counseling on how to manage stress and anxiety, which is something we really haven't talked about much, but that's a big player when it comes to cardiovascular risk. So Yeah, so cardiac rehabilitation is something that is offered for secondary prevention. Unfortunately, it's not offered or reimbursable here in this country for primary prevention.
And earlier you mentioned about endothelial dysfunction, and with secondary prevention for people who've already had an event, whether it's a heart attack or a stroke, to kind of prevent a second event. Actually, before that, once people have had one event, what is the likelihood of them having a second event? Is it much higher risk for them to have a second event?
Yes, that's a great question. Absolutely. So, so it's similar to somebody who has diabetes. So somebody who has diabetes has the same risk as somebody who's had a heart attack from having a second event. So that's what we call diabetes, a risk equivalent. And I believe, if you've had an event, and if you don't do anything about it, you're at least a 30% risk of having a second event, if not higher. But you can definitely bring that risk down with some of the things we've been talking about in terms of lifestyle and medication.
Okay, and so even for these people, it is possible. So even after the first event, it is possible for them to possibly improve their endothelial function.
Yes, absolutely. So what I do is I do actual endothelial function testing in my office, and not everybody does it, but I'm a big believer in that endothelial dysfunction is the root cause of most cardiovascular disease. So I actually do a test called flow-mediated dilatation, where we actually are able to measure the reactivity of the endothelial lining of the arteries, and by being more reactive, we know that they're more healthy. And we know that their endothelial function is intact, and we can actually reverse dysfunction into normal function by changing lifestyle and by being compliant with medications, and by proving that to my patients. It's a great motivator that, listen, my blood vessel health has gotten better because I've done X, Y, and Z. Maybe I'll keep doing that. And like we talked about earlier, that a calcium score does not change significantly over 5 years. So that's why endothelial dysfunction testing can be a big motivator for patients.
And for those of us who might not be familiar with what endothelium means and why it is so important when we talk about cardiovascular disease, be able to just expand on that a bit?
Sure. So the endothelium is a single cell layer that lines the inside of all of our blood vessels. And it has many different functions. It's actually, it's an anticoagulant. It keeps the blood from clotting when it's healthy. It actually, it allows it allows a dilation of the artery, so the lumen gets bigger when there's more blood flow, or if there's a higher sodium load without your pressure increasing. It prevents inflammation and oxidative stress from entering into the walls of the arteries, which leads to plaque formation. So having a healthy endothelium means having preventing cardiovascular disease. And one of the most important things that the endothelium does is it increases something called nitric oxide. So nitric oxide is a molecule that gets released in a healthy endothelium, and nitric oxide fights off inflammation and oxidative stress, which are the causes of atherosclerosis and heart attacks and strokes. So having a healthy endothelium allows your body to prevent those events from happening. And how do you get a healthy endothelium? By a healthy lifestyle. The first and foremost is a healthy lifestyle. We know that by increasing blood flow with exercise improves endothelial function. We know by stopping smoking and not having nicotine on board improves endothelial function. We know that by eating colorful vegetables, even wine in moderation, sometimes red wine, because we know that the skin of that grape can improve endothelial function. And managing stress and anxiety, yoga and meditation have been proven to improve endothelial function. Also, all of those lifestyle things we talk about improves endothelial dysfunction, and that's how it prevents cardiovascular events. So endothelial dysfunction is very important to manage when it comes to prevention.
Could we Talk a little bit more about sleep, as it's a pillar that we don't really expand on enough, but it has such a crucial element in our health.
Yeah. So obstructive sleep apnea is an underdiagnosed condition, and when you have sleep apnea, your carbon dioxide levels increase and your oxygen levels decrease, and that creates stress, increases catecholamines, sympathetic tone, which raises blood pressure, which can lead to arrhythmias, and can make heart failure worse, and can and the way you prevent obstructive sleep apnea is by first diagnosing it by getting a sleep study, and then after that, being either fitted for a mask or a device to help improve the amount of actual sleep that you get in terms of to reduce the number of apneic episodes, meaning where you actually stop breathing. The other things you can do are, losing weight. Weight reduction is a great way to treat sleep apnea. Avoiding alcohol also is a great way to prevent and treat sleep apnea. And sleep apnea is probably the number one, at least in terms of my patient clientele, reason why people don't sleep. Other reasons are things like insomnia, anxiety, stress. But good sleep hygiene, I'm sure we all know about what that means. That means not having a screen in front of you for at least 2 hours before you go to sleep, avoiding any caffeine after 12 noon, avoiding meals or exercise at least 2 hours before you go to sleep. Make sure your room is cool, and if you need to wear night shades over your eyes, that's also important. Make sure the room is quiet. And if you can't fall asleep, get out of bed, sit in a chair, read. Reading is a great way to help me fall asleep. Reading. And we talked about this earlier. I do recommend natural things like valerian root tea or chamomile tea or melatonin. Those are all very natural, benign. Not I shouldn't say benign, but natural forms that that can help people fall asleep.
When we look at other pillars of lifestyle, can we look a little bit about exercise and what is the optimal movement that our cardiovascular patient should be looking at?
So that's a great question. So the guidelines, at least in this country, are 30 minutes of moderate intensity exercise. So that means walking and just being able to speak with the person next to you while you're walking. So you want to do that 30 minutes a day in total, not at once, but in total, at least 5 days a week. And if you do that, you improve blood flow, you improve endothelial function, you can improve memory. There's all kinds of benefits exercise provides. Reduce diabetes, improve insulin resistance, all those healthy outcomes from exercise. Also, resistance exercise is important. You want to make sure that you're doing something that, against gravity. So whether it's bands or dumbbells or something that for your chest, arms, and back at least, that helps prevent bone loss. It helps maintain muscle density, especially as we get older. There's something called sarcopenia, which is not a good thing to get because that can get in the way of balance and falling, et cetera. So people are I don't know if people wear wearables in the UK, but here in the US we're always using our Fitbit or our Apple Watch, and I'm a big fan of that because I find it's a motivator for people to exercise. But I think I don't know. So that the goal of 10,000 steps a day, I don't know where that came from. There's really not that much science behind it. Really, the goal is between 5,000 and 6,000 steps. If you can get there, then you're doing enough in terms of moving.
And for people with heart disease or heart failure, they might feel a bit breathless when they start to walk or exert themselves, and some might start to have a bit of chest pain. Or we mentioned earlier about peripheral vascular disease, and they might get claudication pain in the back of their calves and things like that, and they might be scared to exercise. So what advice would you give patients with symptoms who are looking to maybe move more?
So yeah, that's a great question. So as a cardiologist, I want to make sure that when someone exercises, they can do it safely, right? So they don't have, heart attack or horrible angina or go into heart failure. So, many times I will do some type of provocative stress test on my patients to make sure that it's safe for just walking on a treadmill. I can monitor their EKG, their blood pressure, their symptoms, and then I can see how far they can go safely. And then I give them a prescription about what kind of exercise they should be doing. That's kind of like what cardiac rehab does. Cardiac rehab requires a stress test before they accept the patient, and they use that as a prescription to increase intensity of exercise. Sometimes if they're having symptom limiting symptoms, such as angina with just walking across the room or up a flight of stairs, then there may be something more going on that needs to be addressed. Maybe there's a significant stenosis or narrowing in the artery that's causing these symptoms. Sometimes you need to take more medication. Sometimes, the lifestyle piece does help, but once you get to that amount of symptom with minimal activity, then we've gone beyond lifestyle at that point. But then in that situation, you're going to need to give these people medications or recommend a procedure to fix the blockage so they can move better without symptoms. So every individual is you have to take every individual as a unique entity. When they're having symptoms of exercise, you want to make sure it's safe for them to exercise.
So exercise is something that we have in this case, in this cohort of patients who are having difficulty even with walking. Something they can do though at home is change their Western diets. And when we look at nutrition and diet from a cardiovascular and particularly endothelial point of view, what is the dose specific nutrition that they should be looking at?
So in the US here, we have a great saying: most Americans have a SAD diet, and SAD stands for Standard American Diet. And that is basically, saturated fats and, trans fats and, red meat and fried foods and salt. So salt, fat, and sugar are the mainstay of the SAD American diet. And that's why obesity is so much more prevalent in this country than it is anywhere in the world, really, even I'm sure compared to the UK or anywhere in Europe, because food is plentiful, and it's unfortunate. And it's much easier and it costs much less to eat unhealthy than it does to eat healthy. So what does it mean to eat healthy? So I'm a big fan, and I'm sure you've heard of the Mediterranean diet. So the Mediterranean diet is the only diet that's ever been shown to prevent heart attacks and strokes. It's the only diet that's been shown to improve outcomes and prevent primary events. So the Mediterranean diet is a diet that's rich in whole fruits and vegetables, especially like the colorful vegetables, because that's where you get the antioxidants. It's a diet that focuses on eating, and if you're not vegan, that focuses on eating fish, like the oily fishes, like salmon and tuna and sardines, as well as chicken, lean meats without the skin, staying away from the saturated fats, the cheeses, the red meat and the fried foods. You want to stay away from those things. You want to, the Mediterranean diet is also big with, extra virgin olive oil. Again, that's been shown to have antioxidant, anti-inflammatory effects on the endothelium, along with, healthy nuts like almonds and walnuts and avocados and less of the sweets and the starches. With this pandemic, that has been the go-to for as a comfort food: sweets, starches, and alcohol. And that's why people have gained weight and have had more events. So, things like white bread and pasta, potatoes and rice, candy, soda, ice cream, cakes. I try to, tell my patients that you want to avoid those, and you want to go with Mediterranean diet. There's another diet for hypertension called the DASH diet, which has also been proven to reduce blood pressure by 10 to 15 millimeters or more, just by changing your lifestyle around. And that's pretty impressive. Without, why take a drug when you can just change your diet and, and avoiding salt and sodium. I always tell my patients not to add salt at the table. You can cook with a little bit of salt, but don't add salt at the table. That'll also help lower your blood pressure. And of course, alcohol in moderation. Alcohol definitely raises your blood pressure, as does caffeine if you drink too much. Go ahead. I'm sorry.
Thank you. No, could we have a look at stress? And there is quite an obvious thing that happens. Unfortunately, men do die younger from heart attack, and there's a bit of a link between stress. Could we attack this question, please?
Yeah. So anxiety, stress, depression, they're all sources of increased catecholamine, sympathetic tone, and that raises blood pressure, it leads to endothelial dysfunction. It can lead to heart attacks and strokes. I think the reason men have heart disease earlier than women has more to do with, I think, hormonal changes, because I think estrogen and progesterone in women who are who still get their periods are cardioprotective, while once women go through menopause, the risk of cardiovascular disease actually increases the same as a man. So that's probably one of the bigger reasons why men get heart disease earlier than women. But yeah, so managing stress. So, I'm a big believer in breathing exercises, doing abdominal breathing, which increases something called parasympathetic tone, which is a restorative part of the nervous system, and inhibits the sympathetic tone, which is the more of the destructive part of the nervous system. So it increases. So yeah, and it helps lower blood pressure as well. So typically, I'll recommend breathing in on a count of 4, breathing out on a count of 8. You do that for 2 minutes. You do that 3 or 4 days a week. I'm sorry, 3 or 4 times a day. And I think that people it can definitely help with anxiety and stress. Things like yoga, meditation, tai chi, any type of contemplative exercise can lower sympathetic tone. There's actually good data with transcendental meditation. Doing 20 minutes twice a day has been shown to reduce systolic blood pressure significantly, especially in certain populations. So big fan of that as well, transcendental meditation. I personally took a mindfulness-based stress reduction class that's part of John Kabat-Zinn. I'm sure you've heard of him. And I found it incredibly helpful. Now I do walking meditation, I do sitting meditation. I try to meditate when I'm hiking, when I'm out in nature. There's something called forest bathing, which is big in Japan, where because you're out and all your senses are being engaged with nature, it has a dramatic impact on lowering sympathetic tone and blood pressure. So another way of being mindful is to walk, for me at least, is walking in nature. So.
Absolutely. Meditation is incredible. And Erica is amazing. She's offering on our platform actually free meditation lessons where you can join us on Zoom at 7 in the morning on Mondays. And it is an incredible offering because not only does she help with cardiovascular state, she also helps with my mental health. Thank you very much, Erica, for those amazing classes. I must just give a shout out to you because you're doing an amazing job. So if you guys want to join us, you can do so. And Viral, we would love to have you there as well.
What time is that in the US?
It's hours actually forward.
Probably,
so for you, it would be around 1 p.m.
1 p.m. Okay.
No.
No, is it back?
Yeah, it goes back. Yeah, you guys are ahead of us, so
yeah.
I'll probably be sleeping. So
yeah, sleep is equally important.
We will have to offer one later on just so you can join us.
Sure.
So we have covered stress, sleep, nutrition. Should we look a little bit at any of the other pillars that you find very important?
So, for me, social engagement is critical. Community, having a structure in your life, people that you can count on, and people that can count on you. And the first thing I think of is family, right? So having a family that you're close with, that you're nearby, that you can reach, especially as you get older. And it's important, especially Zoom is great, but it's nothing like actually being with somebody, touching their hand, holding their hand, giving them a hug. That type of interaction, I think, is sorely lacking during this pandemic. It's obviously getting better now, but that was a real problem. And having, not only family, but friends too, friends that you can interact with, that you can do healthy things with. I have a hiking group that I have, and I have this big group of tennis people, friends I play with. So community, the whole social piece is very important when it comes to preventing cardiovascular disease.
Why is that, Viral? Why is that community?
So it's that whole idea of feeling loved, right? That it sounds kind of, I don't know what you want to say, but call it. But when somebody feels loved and feels cared for, increases like things like oxytocin. there's a hormone, oxytocin, I think.
Oxytocin.
Yeah, oxytocin. And it increases serotonin. And these are all beneficial when it comes to cardiovascular health. Just being touched, just being hugged can do that. So yeah, so and a lot of us, we feel, when we feel isolated, we don't feel loved, and we don't feel, some of us don't feel lovable, and that's a problem. So that's where it's important to have, whether it's close friends, family, or even therapists, or support groups for whatever is ailing you, is so important.
This is interesting, actually, because we talk about the Mediterranean diet a lot, whole food, plant-based diet with a lot of beans, legumes, lentils, and the wonderful greens that they eat. I am fortunate that I did visit Greece quite a lot in my last decade. But now that you mentioned community, there's a huge difference in the community of Greek people and actually
Sure.
European, as well as in comparison to the Westerners, where touch and hug is not very common. So we do speak about nutrition in isolation, but very much we should be looking at how do we eat that whole food plant-based
Sure.
diet.
So you mentioned, so part of the Mediterranean diet is drinking red wine in moderation. And the reason it's helpful is because places like Greece and in Europe, where the tradition is to have a meal with family and friends, and sharing that wine and sharing that community and the conversation, that's missing a lot in the US, at least, because I mean, drinking alone is not the same as drinking with friends. And when you're drinking over dinner, it tends to be less alcohol and more conversation. And alcohol is a great way to get conversation started sometimes. So, and I think that's one of the reasons. Yeah.
I must say, in the West, it is more because it's not cultural to come together. So when I moved away from Ukraine to Europe, and then I lived in America, it was, even for a child, it was really obvious that our friends, we would come together in Europe, we would sit together, we would chat together, as it was culturally normal. But unfortunately, as we went to the West more and more, and now in the UK, it became a thing that you needed a reason to sit together, sit around alcohol or other things. But most often, unfortunately, our children are sitting in front of the TV. They're not putting the importance on coming together and having that conversation. And I think it's important here to highlight, if you can do that, that it's not only a nicety, but it actually can save lives, right?
Absolutely. And so many times I'll see, at restaurants, families sitting around at a table and everyone is on their smartphone. There's no conversation. So even if you're having a dinner with people, you gotta put the smartphone down, and you have to, actually engage in the person in front of you. So.
And also, you talked about oxytocin, which comes from touch. It's something I must share. When I went back to Portugal for my European trauma course, I loved how my Portuguese friend put it. I came and I said, in the UK, people, when you come to Cambridge to do your anesthetic fellowship, don't really come too close and don't really touch people or look into their eyes, because this is not a common cultural thing to do. And she was startled for a second, and she said to me, Linda, if people don't look into my eyes and don't touch my arm when we talk and don't hug, then she said to me, how do I know that I exist? I thought that was really, really powerful.
Yeah, sure, absolutely. The power of touch. You really nailed it there. I think, yeah, especially with this pandemic, no one was touching each other. No one was hugging each other. No one was shaking hands. I still don't shake hands with my patients. They don't want to shake my hand. And it's, and that was one of the things that, like you mentioned, the touch piece, it's so important. That's why I think, hopefully, I'm hoping it comes back, the hugging and the touching. So.
Absolutely. It's very important for sure. Erica?
Yeah, and I wanted to also touch on, because you also see patients for primary prevention as well, those people who have come to you perhaps because they've got a family history of heart disease or strokes, and they're wondering what they can do about it. We often hear from people, oh, it's in my genes, it runs in my family, I'm bound to get this. But we also know from Dr. Ornish's work that actually we can actually change hundreds of our genes within 3 months' time by changing our lifestyle, and that genetics is actually not our destiny. And I wondered what how you kind of approach this in your clinic setting.
Yeah, so you're talking about a concept called epigenetics. So epigenetics is when the environment can actually change the expression of your genes. So you're not destined. There's no fate here. You can change your life. You can change your future. I mean, just because your father had a heart attack in his 40s doesn't mean you have to as well. So absolutely, and a lot of the the lifestyle changes that we talked about do change the genetic expression in people. So coronary artery disease is a multifactorial disease. There's just not one gene. There's many genes and there's many risk factors involved. That's why we have risk scores, and that's how we know what your risk is going to be. Genetics are an important piece, and for me, they're a clue that maybe I need to dig deeper and look deeper to see if there is a problem. That's why I do my calcium scores so often in these people who have family histories. And then I can say to them, listen, you're feeling great, but look what your genes are doing on your insides. And then you need to change your behavior. And and then by doing that, you're going to prevent them from having a heart attack. Absolutely. And also, the older generations did smoke more than people do now. And smoking has gotten, thanks to, I think governments have taken the lead on, especially in the U.S., in terms of getting people to stop smoking. I think it was like 30 years ago, like, I don't know, 40% of Americans were smoking. Now it's down like 20%. So that's a big one. That's low hanging fruit, getting somebody to stop smoking. But the other stuff in terms of weight loss and exercise and eating right, I mean, that's one of those things that you don't see the benefits right away. There's this great commercial on TV where someone who's overweight runs around his gym once. No, before he runs around, he gets on the scale. And he runs around once, he gets on the scale again, hoping it's going to change. So it's like, no, that's not the way it works. It's kind of you need to be persistent, and there's got to be long-term goals, and you didn't get that way overnight, so you're not going to get better overnight, right? So
absolutely. I think so often we're looking for instant gratification, instant results, instant everything now, that when we change something for a day, we're hoping to see results. But as you said, it's taken years for us to get to this point.
Yes.
It is going to take time for us to start to see some changes, but actually the time might not be so long, and very often people can start to see results in their blood pressure, in their cholesterol levels, in their sugar levels and things like that within 3 months' time, when they make the appropriate changes.
I've had people reverse diabetes with just a 10 or 20 pound weight loss. So we're not talking 100 pound weight loss. We're talking incremental weight loss, 1 pound a week or every 2 weeks. And that's so doable just by like avoiding, 3 desserts in a week, or, not having that third glass of wine. Or I tell you, people who stop drinking alcohol, they lose weight. It's crazy. Alcohol is a nutrient less calorie that, it's great for diabetes and weight management.
It's amazing how fast this chronic disease can actually respond. Not long ago here in afternoon, see one of our patients, Gary, he has within 2 months, at age 55, with 10 plus years of metabolic disease, he was able to get his cholesterol reversed completely, off of his statins. His blood pressure plummeted within 2 short months, with sustainable lifestyle changes. And it's just incredible to know that I have met him in the emergency department with something that would have progressed to a heart attack very, very, very shortly. And just by hearing and listening and applying those changes, he was able now to prevent this catastrophic event. It's incredible, your message and what you do. Viral, could you actually share one of your stories, patient success stories that inspired you and continues to inspire your work?
So there are so many, I tell you, the patient you just mentioned, not only is it rewarding for the patient, but it's rewarding for you, right? You
Yes.
feel like you made a real difference in their lives. And there are there are so many of my patients where, where I just by me being there and taking the time to listen to them. And that's what's important, something called active listening, where you're focused, I tend to sit, below where they are, and I tend to, I'm totally engaged, and I say less. And at the end of the conversation, I'm always asking if they have any other questions, because then they feel like they're being heard, and they can trust me. And then once you get their trust, then it's easier for you to make recommendations that they will follow. And yeah, no, absolutely. I've had so many of my patients who've been able to get off their blood pressure medications and their diabetes medications and their cholesterol medications just by just by me getting their trust. And it's so important. Trust is something that is earned. It's not, just because you're a provider, they walk in a room. There's a lot of skepticism out there. A lot of patients feel like we're just, pawns of the pharmaceutical industry. They feel like their best interest really isn't, and they just want us, especially in specialties, patients feel like they're just there to, order tests on, make money. That's, at least that's the way here is in the US, because here it's still a lot of it's fee for service. So yeah, so getting their trust is so important. And once you get their trust, the impact can be tremendous because they feel like you have a vested interest in them. So yeah.
Do you see cholesterol and blood pressure change quite quickly in your clinic as well?
Yes. So, the biggest thing, the biggest behavior change where I see benefit with blood pressure is exercise. If somebody can start moving more, their blood pressure comes down. It has to do with that nitric oxide that we talked about earlier. Um, and and just by, I have some people who just love salt and sodium. And you just tell them to don't stop adding salt to your food, and then you'll see a significant drop in their systolic blood pressure. In terms of cholesterol, that is more challenging in this country because so much of what people eat is loaded with cholesterol. It's like we talked about that SAD diet, getting somebody to eat whole fruits and vegetables and prepare meals and go to the market for those vegetables takes time, and it's more expensive than it is to go to like a fast food restaurant type of thing. So getting cholesterol down with lifestyle change can happen, but it's more challenging than blood pressure. But weight loss again is also one of those things that's challenging in this country, in the U.S., because sweets and starches are the staples of a lot of what people eat in this country, and it's so difficult to get people to lose weight just by changing. Weight loss, 80% of weight loss is nutrition, 20% is exercise. So the nutrition piece is so important when it comes to what you put in your mouth is everything. So I'm a firm believer. I'll promote one more time of intermittent fasting, because it's not easy to do, but it's one of those things that you start off by doing a 8-hour window between noon and 8 p.m. where you eat. Typically, it's 2 healthy meals. But I've been able to get my window down to 4 hours. So I eat only 1 meal a day, but it's a nutritious meal, and I have more energy. I rest my gut. There's less inflammation in my body. And I lost, like I said before, like 20 pounds doing that. I'm able to maintain that for the past 5 years, in addition to having the energy to exercise. So, it's all about caloric restriction, no matter how you do it, whether it's smaller portion sizes, 3 meals a day, fewer sweets and starches during the day. I'm not a huge fan of the keto diet. Some people feel like the keto diet it's great for losing weight, but it's really hard to maintain long term, and it wreaks havoc on your cholesterol. Not everybody's cholesterol, but many people's cholesterol, it wreaks havoc. So, but a lot of people in this country want want an immediate effect. So they go with the keto diet, and they lose their, 10, 20 pounds, but they gain it right back when they go back to their regular diet. So
to mention on that, unfortunately, one of my patients was put on a keto diet by a health coach, and he was already an angiopath. And within 4 months, he completely lost his libido. It was a very sad side effect. It really affected his lifestyle, and it pushed him into depression and a lot of anxiety, unfortunately. So something to be really cautious of, especially when you do suffer from heart disease. So just conscious of time, I would love to just ask, what are the 3 things, practical takeaways that our patients could apply right away if they were inspired by your talk?
So first of all, I'm a big fan of exercise. So if you can find a friend and walk with a friend on a nature trail, and you do that for 20 minutes, half an hour, and somebody you enjoy having conversation with, you'll be more likely to keep doing it long term. So that's one thing. Number 2, just when it comes to sweets and starches, try to eat less of white bread, pasta, potatoes, rice. The sweets, the alcohol. I mean, those are I call low-hanging fruit. So if you can do that, you can have a tremendous impact on inflammation in your body. You can reduce that.
Sorry, Vera, can I just mention here, when you say starches, you're talking about the processed starches, aren't you?
That's correct. The whole grain is fine, like the whole oats, those are very heart healthy. But you're right, the processed foods you want to try to avoid. So definitely. And the other thing is, managing stress and anxiety. We all have stress. We all have to live life on life's terms. So it's really important for us to be able to manage that stress. That's why I'm a big fan of mindfulness-based stress reduction, meditation, yoga. Those are easy things to do. They're free. They're cheap. There's apps. I mean, Erica can teach you how to do that stuff. So it's really something that we can all do, and it can have a tremendous impact on how we view ourselves and our lives and the people around us. So.
If our listeners would like to get in touch with you, Viral, which is the best platform?
Probably email. They can email me. I don't have my email on there somewhere.
Yeah, and we have just added all of your contact details into the chat, and also it's added onto YouTube as well.
Excellent.
Thank you so much for joining us today, Viral. We hope you enjoyed your time. And from now, we are going to go to the non-recorded Zoom chat, where you can ask questions from Viral and from us, so that you can live your best life. Now, if you are new to us, please join us on social media on Afternoon Tea with Docs. You can find us on Instagram, YouTube, and Facebook as well. And check out our website, afternoonteawithdocs.com. Here you can become a member free of charge and join the online community and watch the live sessions as a series, so that you can find all of your answers to chronic disease reversal. Now, for you who have joined us on YouTube, please hit the subscribe button. We really appreciate that you support us, and share this life-saving recording with those who would most benefit, but also those who you think could prevent heart disease. Thank you very much once again for joining us. We'll go off to our non-recorded session now.
Thank you.